Okay, let's move on. We're going to talk about some anatomical terminology, and this is not every word you're going to have to know for the whole semester, but it's a lot of like overview. It's basically like condensed medical terminology into one little section. So we're going to go through and talk about some of the key words that you really have to pay attention to or watch for that are going to make this semester go a lot smoother. So anatomical terminology is kind of like learning a totally different language, because in reality it is. You're learning Greek and Latin at the same time. You're trying to make sense of these things and use basically languages that aren't used so commonly, like Latin any day or nowadays. So the reason we want to do this is because no matter what language you speak natively, by using the proper anatomical terminology, it becomes a universal language. So it doesn't matter if you're from China or Japan or from somewhere in Europe or if you're from the United States or South America or wherever, by having this unified terminology, we can speak to each other. We can put it in a medical record and send it across the globe, and everybody can translate it just the same. Right. So the next several slides I'm not going to spend a lot of time talking about, but I put them in here so that you can go through and you can print them off and keep them in the front of your textbook, so that if you see a word that you don't understand, just look at the pieces of the word. So you're going to print this list off and you're going to keep it handy with you, all the time when you're in class. When you look at some of these things, when we're talking about having like the prefix and suffix and whatnot, if you look at a word that starts with the letter A, I'm trying to find my mouse, there it is. A, it means without or the absence of. So if I say you have a disorder called anosmia. So A means without. Nosmia is referring to smell. So what's your problem? Well, you can't smell things without the smell. So if let's see if we can find another one. Some of the terms like bi, so means two. So bicuspid means it has two cusps. You've probably heard other diseases like bipolar disorder means that they have extreme ups and extreme downs. When you look at words like cyto, which is actually not in here, but cyto is just like cyte, which is referring to the cell. So if we talk about something that's called the cytoplasm, it's the cellular plasma. If we talk about the cytoskeleton, it's the skeleton of the cell. Let's see. Let's go to another slide and kind of take a peek at it. Exo is talking about the outside. So in insects, they have an exoskeleton, which means the outside skeleton, right? So we're going to use a lot of these over and over and over again. And if you learn what they mean, then you see a word that you don't know or have never seen before, you can break it apart and put the pieces together. Okay, so you're using these terminology or these terms so that it's kind of like understanding how to read a map and tell directions on a map. When you learn the terms to guide you through the body, it's just like saying, hey, you turn left at this road, go for 4 blocks and take another left, and then eventually 5 blocks down the road you'll be at your destination. When we use the body, we use these terms, we always refer to the anatomical position. So you describe things in an anatomical position. This is what the anatomical position looks like, and here are the characteristics. When you're describing something, you always want to imagine the body standing upright, the person facing you, so standing erect, facing you, their head, their eyes are straight forward, feet are flat on the floor, upper limbs to their sides, and the palms turned forward so that your thumbs are pointing to the side. This is different this is specific, and it's different than like Eastern medicine where it shows the person tilted kind of sideways, almost like they're doing a moonwalk or something. But this is the anatomical position, and kind of the key is that the person is facing you, whether they're laying on a table, you describe them the same way as if they're standing upright, but their palms are outward. When we describe the surface anatomy, so this is one of the types of anatomy, where we go through gross anatomy and surface anatomy and regional anatomy and all of that. The surface anatomy is actually study what's on the surface of the body. You don't have to touch them, you don't have to cut them apart, you don't have to do anything. All you have to do is observe them from the outside. If you want to touch them, that's called palpation. So you can palpate or touch these different areas to see what's going on underneath. Like a lot of times doctors will palpate the abdomen to see if they can find the source of pain. Maybe you palpate to find a pulse. So we're going to talk a little bit about surface anatomy and some of the terminology that comes with it. Some of these terms, they're used like layperson's terms. Like you probably have used them before and didn't realize it was the actual technical term. But we'll distinguish between some of the layperson terms and some of the technical terms here. When we talk about the regions are the areas. So like for instance, a leg is not a region. The leg is the anatomical structure. The upper leg region is actually what we refer to as the femoral region. So technically the leg region is down here between the knee and the ankle, where the femoral region up here is between the waist and the knee. So using the regions as a general area. When we talk about the head, we're talking about the skull and the face. When we talk about the neck, we're talking about, of course, the connector between the trunk and the head. And here's some terms for the regions. So some of these, like I said, you've probably used before. The pubic region, you probably used that. So pubic region's down here. Pelvic region in general is going to be up right above the pubic region. When we talk about lumbar, some of these terms have significance when you think about when they've been used. When have you had a lumbar support or heard of somebody getting lumbar support? Where does it go? Well, it goes in the lower back. So the lumbar region is going to be along the bottom of the back. Brachium or brachial is referring to the arm. So when we're talking about the upper arm, the antebrachium is going to be down here at the forearm region. When we talk about cephalic or the cephalon, we're talking about the head, so up here. When we talk about popliteal, we're talking about behind the knee. Pectoral, you probably heard of before when somebody has developed pecs. Of course, we're talking about the upper chest. Plantar is where you firmly plant your body to the ground, so it's the surface of the foot. Pedal is referring to the foot, and I like that word pedal because it looks like pedal, like you put your foot on a pedal. So when you're looking through these, and I'm not going to go and read every one of them to you, these are regions. It's important to get familiar with them and learn them a little bit, because when we talk about some of the muscles, some of these muscles actually have these regional terms in their name. When we're talking about blood vessels, the same idea. So like when we're talking about a brachial artery, where would you find a brachial artery? Well, in the brachium, which is referring to the arm. So the brachial artery would go up here through the arm. This is a picture I used from a textbook that I used to teach out of. And here you can see the different regions. You can use this if you wanted to print it off and just keep it as a little handy reference. You can. You can even go to this website and test your knowledge. It's a game that you can go online and play with. And it's where you plug in the different regions. So what it does is it teaches you these regions, and then it gives you a quiz where you'll connect the names to the appropriate places. And I recommend you try it. It's kind of fun when you're just sitting on the couch watching TV to take some of these games and actually play them when you're not intensely thinking and just goofing around. Because every time you get exposed to it, the better and better that you get with it, remembering it. All right, so let's navigate through the body. Here's some terms you definitely have to memorize right away, because starting next week when we're describing everything, I'm going to use these terms. I'm just going to expect that you already know them. So I'll go through them with you one time real quick, but I would definitely write them down, reference them, or use them as much as possible. I got really geeky when I was studying anatomy. I would go home and I would use the terms, and it drove my girlfriend at the time crazy. I think she said it was cute, but I think it just drove her nuts because I was using these terms to refer to different directions in the room or whatever. So here's a short list of the ones we're going to go through. And I'm going to go through them individually in the following slides, but here's the list. So anterior, and by the way, these terms, a lot of them oppose each other directly. So anterior versus posterior. Anterior is referring to something being towards the front of the body, where posterior is referring to it being towards the back. You may also hear the terms ventral and dorsal. Ventral is referring to the front, dorsal is referring to the back. A lot of times you'll use ventral dorsal when you're talking about quadrupeds, anterior and posterior when you're talking about a biped like us, where we're standing on two legs in the front and the back. But we will use the term ventral and dorsal when it comes to humans too. So a lot of times ventral is interchangeably used with anterior. It shouldn't always be like that, but some people do, and posterior and dorsal. And dorsal you can remember because a dorsal fin on a dolphin is where? It's on its back. Ventral I always remember is the front, because when you're ventilating somebody, you ventilate the front of their body, not their dorsal region. Right? And then superior versus inferior. Superior means towards the head or up towards the top of the body, where inferior is referring to lower. And I kind of want to point something out right away. When you're using these terms are comparative terms. They're not absolute terms. It's like, for instance, if you've seen me, am I a short person? Well, if you compare me to somebody that's 6'4", I'm short. If you compare me to somebody that's 4'11", I'm tall. So when we're describing directions of things like anterior, usually you'll use some reference point in the body, like it's anterior to the heart, or it's posterior to the heart, or it's superior to the heart, or inferior to the heart. You'll give some kind of direction. Right? Next is proximal and distal. When we're talking about the limbs, if it's close to your body, if it's close to the core of the body, we say it's proximal. It's near the trunk, or it's near the center of the body. Distal means it's further away. So if I were using terms to describe what's going on here, if I said my wrist is something compared to my elbow, would it be proximal compared to my elbow or distal? It would be distal. The wrist would be distal and the elbow to the elbow, and the elbow would be proximal to the wrist. It's closer to the middle of the body. Right? Lateral means if you drew a line straight down the middle of the body, the trunk, lateral means it's further from the midline. So if I were just describing the hand, I would say that the thumb is the lateral aspect of the hand, or it's lateral to the digits. Right? Medial means it's closer to the midline of the body. It's near the middle of the body. When we talk about ipsilateral and contralateral, ipsilateral means that the two structures on the same side of the body. So if I talk about the right shoulder and the right elbow are ipsilateral, that means they're both on the same side. If I talked about the right shoulder and the ipsilateral lung, they're both on the same side. If I say contralateral, it means opposite. So like when we talk about the brain, you probably heard the right side of the brain controls the left side of the body. It's contralateral control. So point of reference again is important. You always want to use some kind of a reference point. So when you write statements and you talk about the head and the chest, you want to use and say, the head's superior to the chest. But technically, you would say the cephalic region is superior to the thoracic region. So those would be some technical terms in describing, where the thoracic region would be inferior to the cephalic region. So let's see if you can interpret the following medical record. The medical record said the lesion extends from the medial aspect of the inguinal region laterally to the lateral femoral region. So if you look back through the regions and look at inguinal region, you'd see that the lesion extends from the medial part. What's that talking about? Medial means somewhere along the inside. And the inguinal region is talking about in this region up here, above the femoral region, down near the pubic region. Right? And then it says laterally, so it's going outwards to the femoral region. So it's coming over and outwards. In other words, this person's cut or this damage starts in here and cuts across. Maybe they dropped a chainsaw on their leg or something. I don't know. But it describes the direction. This is a little bit tougher. So it says the patient reported with a moderate injury to the cervical region. So if somebody wears a cervical collar, where does that go? Around their neck. So it says moderate injury to the cervical region, so obviously in their neck. Right? Actually, I'll walk through this. On the right side with radiation of pain into the ipsilateral brachial region extending distally to the antebrachium and the carpals. So there's one of these words I didn't mention. Well, two of them, cervical, and there's one other one. If you look, cervical region is talking about the neck, right? Cervical collar. On the right side, so it starts with a minor injury on the cervical region on the right side, and it radiates pain on the ipsilateral. What's ipsilateral mean? It means the same. Brachial region is what part? Brachial, referring to the arm, extending distally, so extending further down the limb to the antebrachium and the carpals. Carpals, where's that referring to? Think about it. When have you heard the word carpal? Carpal tunnel, right? And they have a surgery on their wrist. So in other words, this is saying that this person has damage on their right side to the neck, and it's radiating pain down into the arm, the brachial region, ipsilateral, same side, right side, into the antebrachium, which is the forearm, and all the way down into the wrist. Right. If you want to play around with terminology, here's another little game website you can go to, and this gives you a chance to actually use some of those words and see if you're using them appropriately. Next are body dissection terms. When we cut the body apart, how do we describe those cuts? Here you can see scans, MRI scans, and slices across the body. Here you can see this is from a Body Worlds or Body Works exhibit where they took a body and they sliced it and they spread it apart. So when we're doing dissections, we want to describe the dissecting we're actually making. And you can see these are all different planes, or when they're cutting in different directions across the body. So this is separating the top from the bottom, the superior section from the bottom. Obviously this is a slice of the head. You can see the eyeballs and the brain and the nose. Another slice of the head, but this separates the person's left side from its right side. Right? And then this one, you're slicing and separating the front of the head from the back. We'll talk about those. So we call these planes or sections. Right? So just imagine there's a sheet of glass or a razor that goes right through and cuts people in certain ways. The first cut's called the frontal or the coronal plane. Corona is referring to a crown, and I always think of a tiara. So when we're a tiara that goes up and over, it separates the front of her face or the front of her head from the back of her head. So the frontal plane separates the front of your body from the back of your body. And here's this glass that would go through. So if we slice straight down, you can see it would separate the face off. It'd separate the front part of the face. It'd separate the back of the face and the back of the head. These are all frontal or coronal sections. Right? Next is a transverse plane. Transverse means across. So it's slicing across the body. It would almost be like you cut the top part of your body apart from your bottom. A lot of times it's referred to as a cross-sectional or horizontal plane. So here you can see a cross-section or horizontal scan here. So you cut across the body and you look at what you're looking at. Typically when you're looking at a picture like this, you have to imagine you're standing down here at the feet of the person and looking up. So you'll see the picture from this perspective, and you just have to imagine there's the back, and if you forget, there's a vertebra that helps identify it. There's their chest, or the most anterior portion of the body, and you're looking up as if you're standing at their feet looking upward. Okay. Next is a sagittal. Sagittal splits your left side from your right side. So here you can see sagittal cuts going all the way along. Here you see a sagittal cut going right down the middle. If it's perfectly in the middle, it's called mid-sagittal, which means that you're basically a mirror image. Everything on the right side of your body is also on the left side of your body. So if I sliced you right down your nose, all the way down your belly button, straight down the middle of the sternum and the chest, and separated you, that would be a mid-sagittal plane. Parasagittal means it's off to one of the sides. It's not perfectly down the middle. Right? Next is oblique. Oblique's referring to angles, and you can see this is kind of a diagonal cut. So it's not exactly transverse, it's not exactly sagittal, or it's not exactly transverse or not exactly frontal. It's kind of at an angle in between the two. I don't see a lot of these. Most of the time you'll see transverse cuts or sagittal cuts or coronal cuts. So where it's cutting the whole body in a nice flat, 90 degrees to the surface type of thing. And then when we cut these out, we call them sections. Right. If you can take one organ, you can do the same thing. So that first slide that I showed you with the directions, you can see these are all the brain. In this situation, I take a transverse cut. Remember, a horizontal cut across the body. I take that brain, slice through here, and separate and look at the bottom versus the top of the brain. Same thing with an MRI. Right? The coronal plane, remember, right across the top of the head where the tiara is at, you separate the front of the brain from the back of the brain. Right? Sagittal would split your left from your right. So here's a cut right down the middle of the head. That would be mid-sagittal if it's right down the middle, and you separate the left and the right sides. Next are the organs are arranged in cavities. And these body cavities are little compartments that hold things. There are two major body cavities. First you have the dorsal cavity, and then you have the ventral cavity. Dorsal is kind of describing where it's at. What did dorsal refer to? The front or the back? Dorsal's in yellow, and you can see it's primarily the back part of the body. Yeah, it does include the head, but straight down in the vertebral column too. Where the ventral cavity consists of most of the things in the front of your body. Right? These can all be subdivided. Like the dorsal cavity can be subdivided into the cranial and the vertebral cavities, where the ventral can be subdivided into the thoracic cavity and the abdominopelvic cavity. Heck, you can even subdivide this. The abdominopelvic cavity could be subdivided into the abdominal cavity and the pelvic cavity. Or even the thoracic cavity can be divided into the pleural cavities or the central mediastinum. Right? So where the lungs are versus where the heart's at. So there are a lot of divisions. Oops, here's the picture here. So there are the pleural cavities. Here's the mediastinum that holds the heart, the pericardial cavity. Right, here's just some more details about the dorsal cavity. The cranial, of course, wraps around the brain, so it has things called cranial bones. The vertebral cavity is made up of the vertebra, and it houses the spinal cord. There are special membranes that are underneath these bones that help protect the organs that are in there. And in the brain and the spinal cord, there's a layer called the meninges. And of course, you've heard this because when you have meningitis, it's an inflammation of the meninges that wrap around the brain and the spinal cord. Ventral cavity, I already talked about this, the chest cavity. You can subdivide this up. When you're talking about the thoracic cavity up here in the top of the chest, it's the lungs and it's the heart. When you define the barriers, it's everything that's underneath the rib cage, but above the diaphragm, which is a big sheet-like muscle that comes across here, and below the throat. So it's this entire area here is the thoracic cavity. The mediastinum is right up the middle. So that bone, the sternum, the mediastinum sits right behind it. And of course, the separator on the bottom that separates the abdominal pelvic cavity from the thoracic cavity is the diaphragm. So cavities in the thoracic cavity, you have the pleural cavity, which is the lungs. So here you have a pleural cavity. Okay? And here you have a pericardial cavity, which sits in the mediastinum. Pericardial is telling you it's around the heart. Peri is referring to the perimeter, and cardial is referring to the heart. Next, abdominal pelvic tells you exactly what we're looking at. The abdominal cavity, where most of your abdominal organs are at, like your stomach and your small intestine, and most of the large intestine. Right? The pelvic cavity is talking about what's inside the hip region. Right? And the pubic region is right down, obviously, where the pubis is at. Right? Other cavities, they're there, but they're not as significant, so we don't talk about them as much as far as being a major cavity. But the oral cavity, where you chew, the nasal cavity for air passageway, orbital cavities for the eyes, the middle ear cavities, like that are connecting the throat to the ears, called the eustachian tube, that's a cavity, and then synovial cavities, which are in joints. Like when you move your elbow or your knee, there's actually a fluid-filled cavity there. So here's kind of a review slide that goes through and subdivides all the cavities. So when we talk about an organ, and I'll mention the name of the cavity, you should know exactly where I'm talking about. Right? There are membranes all over the place. Membranes help separate those different cavities. They also help separate the organs. Your organs aren't all glued together. They're actually kind of fluid, and they can move across each other, which is really a serious problem when you're in a car accident at high speeds because it shakes those organs and shifts the organs. When we're talking about the different types of membranes, the first is called a serous membrane. And this is a slippery membrane that covers the viscera. Like, for instance, your small intestine and large intestine. They're not stuck in there. They actually slide over each other as if you were interlocking your fingers and sliding your fingers back and forth like Mr. Burns. Excellent. Right? So you have this slimy layer that allows the GI tract to move back and forth. When you describe the layers, the layer that's actually touching the organ is called the visceral layer because viscera refers to the organ. The layer that's not touching the organ directly is called the parietal. So if, for instance, I was talking about maybe my heart, if my heart were like my fist and I pushed it into this water balloon, the water balloon would wrap up and around it. I didn't break the balloon. The part of the cavity that touches my organ of interest, the heart, that's called the visceral layer, right? But as soon as it separates out from the organ and it's away from that organ, it's called the parietal layer. It's continuous, comes all the way back around, no breaks, and then when it touches my hand again, or my organ again, then it's the visceral layer again. So just some terminology. And viscera just means the organs of the thoracic or abdominal pelvic cavity. So just think organs. Some of these special membrane cavities, the pleura is around the lungs. It's a fluid-filled cavity around the lungs. Right? It has the visceral layer. It has the parietal layer going around. The pericardium is the same idea. It just surrounds the heart. It has a visceral layer that touches the heart. It's continuous all the way around, and as soon as it peels off the heart, it's called the parietal, comes around, and then connects again to the heart, the visceral. So it's one layer, and there's a fluid inside of there. Same with this, fluid inside of here. Why do you think you would have fluid around the heart and the lungs that are moving 24 hours a day? Reduces friction. It's a lubricant, right? So there are other things that when you get into physiology, you'll learn about the lungs, but for now, you just want to remember it's a lubricant. Protects. Okay? And the peritoneum is the serous membrane around the abdominal cavity. And when we start taking the internal organs out, we'll actually point this out and we'll look at it. Right. Next, we're going to talk about how we can divide the abdominal pelvic region into special areas. And we'll talk about two methods. One's the quadrant, and quadrant's telling you 4. So you just go straight down the middle through the umbilicus, the belly button, and you just go diagonally across, and you can divide it into 4 quadrants. Here's a good learning point. When you're describing left versus right, it's not your left and right, it's the patient's left and right. So if this is the patient's left hand, then this is the left upper quadrant, where this is the left lower. When you're looking at the patient's right hand, this is the upper right, this is the lower right. And you can see some of these organs in here are specified in those quadrants, but a lot of them overlap. Like, for instance, this is the liver, and the liver goes over to both upper quadrants, the left and the right. But the gallbladder, the little guy here in the green, is only in one quadrant. What quadrant's it in? Right. But when you look and you subdivide into the abdominal pelvic regions, there are 9. It's like a tic-tac-toe board. There are 9 regions altogether. And you can see it becomes a little bit more challenging when you're talking about the gallbladder. It's clear here, but over here it kind of borders. So we'll talk about these. So the abdominal pelvic regions, what you want to do first is draw your tic-tac-toe line. So the first line you're going to draw is something called a subcostal. Sub means what? Below, like a submarine goes below the water. Costal is referring to the ribs. So where would that be? Well, here's the ribs, so it would be below the ribs. Subcostal goes right across the bottom of the ribs. Right? Next, you have something called the transtubercular line. Right? And this goes inferior from the top of the hip bone across to the other hip bone. So if you put your thumbs here, you can feel the hip bone here and the hip bone here. Just imagine a straight line going across and connecting it. So now you have your 2 horizontal lines in. Now we're going to draw your vertical lines, and those are called the mid-clavicular lines. So mid means the center. What's clavicular referring to? And the clavicle. So here's your clavicle up here. If you imagine right about in the middle of the clavicle and drawing straight down, you can see it doesn't go through the nipples. Is it lateral or medial to the nipple, the areola? It's medial. It's closer to the midline. So they go medial to the areola, and they're drawn down. Now you have 9 specific regions in here. So when you're labeling them, here they are. You have the right and the left hypochondriac region. So here's the right and there's the left. In between you have the epigastric. So epi is referring to it slightly superficial. Gastric means the stomach. Here's the stomach, and it's just above the stomach. Right? Here's the epigastric. Here's the hypogastric, which means lesser than the stomach. It's way down here. In between, right in the center of the tic-tac-toe board, is the umbilical region, which revolves around what structure? Your belly button, right. And then the lumbars, remember, if you have a lumbar support, it's for your lower back. So if you imagine the lumbar support goes from over here at the right lumbar region all the way over to the left lumbar region. And then the last are the inguinal regions. So inguinal region, remember, is right in here. So you have the right inguinal and the left inguinal, or a lot of times they're referred to as the iliac region, because that's the name of the bone here in the hip. It's called the iliac bone, or the ilium. So when we're looking at organ here again, you can describe the stomach is primarily in the epigastric region, right? But it can be overlapping or borderline. And in fact, just even in these cartoons, you can see that this one sits almost completely in the epigastric, where this one, most of it almost looks like it sits in the umbilical region. So it varies a lot. When you're following things like a large intestine, you can follow and describe it going into the different abdominal pelvic regions. And we talked about the quadrants. This is simple 4 points that you're drawing straight across the umbilical and straight up and down with the umbilicus. So you're basically making a big up and down and sideways, and separating into 4 regions. So putting it all together, you can figure this out. This is kind of an exercise to figure out what organs are they talking about. So the blank organ is located in the thoracic cavity, deep to the sternum. So that was a term I didn't cover, but it was in the list. Deep means it's deeper inside of you, where superficial is more on your surface. When you talk about people being very superficial, that means that what they show you on the outside is really all that there is to them. There's nothing deep about them. There's nothing deep in their personality. It's very superficial. So when you're talking about the thoracic cavity and deep, you mean it's deep down inside of the person. So it's deep to the sternum and lateral to the mediastinum. The medial border of the blank, this organ of interest, extends along the parasagittal plane. So not mid-sagittal, it's parasagittal, beginning at the lateral margins of the mediastinum and extending laterally to the margins of the thoracic cavity. This organ terminates inferiorly, so on the bottom side, with the diaphragm, and superior up on the top with the superior margin of the thoracic cavity. So what organs are we talking about? Well, we're describing it being right here in the chest and to each of the sides. So it's the lung we're looking at. So here's some more terminology, and like I said, you can print these terminology pages if you want. Here's some links that give some tips and pointers, and all the significant ones are in there. So you can print it off, you can keep it in the front of your book, and when you need it, you can come back and look through it. All right, that's all for this section. So you can go ahead and do the language of anatomy section in the lab manual for the next time that we meet, so you can take your quiz.